we believe that every country could do better, even countries that have seen tremendous progress in terms of both kind of health protection and health promotion, we think could do better. Every country has health inequities. Even when we think about relatively wealthier countries, if we look here in the United States, the U.S. has the kind of unenviable distinction of being one of the only countries in the world to see our maternal mortality rate increase in the last few years. We've gone from 23 maternal deaths per 100,000 people, which is far too high, to 28, which is far too much higher, in less than a decade. So we know we have more work to do here in the U.S. to ensure that every woman can deliver safely, that every child is born in a safe and secure environment, and equally importantly has the chance to grow up to be healthy. So I think when we spend a lot of time being kind of engaged with the world and sometimes being critical of what happens outside of our home countries, we have a moral obligation to also kind of look at what's happening here in the United States and to see what more we can, and I think we would also argue should be doing to help improve health outcomes here in the U.S. as well.
I think you can look at countries like Thailand, which decided very early on to adopt universal health coverage, and the global community said they were crazy. You're way too poor a country. You can't afford to do this, and they just made a commitment. No, we're going to do it, and they built the institutions and they built the evidence, and actually they're doing really well in their health outcomes, and they're not one of the richest countries in the world, but because their population is healthier, they're definitely doing much, much better than many other countries.